There's good news this morning. You no longer need to live with the discomfort of varicose veins. And here to tell us why that is Dr. Gamal Wazni from United Vein Centers. Doctor, how are you?
Good, thank you.
Well, welcome back. We love having you here on the show. And I gotta say, I'm curious, what was it about helping people that have vein disorders that kind of drew you into practice in this area of medicine?
Back when I was training, we were stripping veins. I'm not sure if you've heard of vein stripping. They used to do that back in the day. Well, just about that time, around 2004, 2005, lasers came out, and I was intrigued. I was intrigued how quickly we were able to treat the patients compared to the old method, and fascinated by the technology. So just took off from there.
And you're kind of hooked there at the beginning when it comes to the technology. And I think it's interesting because in talking with you, technology is something that you're still passionate about, and you still try to help other doctors, right?
Correct. When we first started out, it became pretty popular only because now we were able to treat vein disease rather quickly. So more patients that were suffering with the pain, aching, and swelling were coming in to get treated, and we quickly needed more physicians to help us out. So we started training doctors on this new technology, and it's fun. They fell in love with it also, and you know what they say, be careful what you do. If you love it, it'll really become your life.
And it seems like, you know, this technology that you're able to do and how quickly you are able to help patients, other doctors must refer their patients to you, right?
Yes, it's becoming more popular. Primary care physicians these days are aware of it. They do know that if they get a patient where their legs are swollen or their legs feel tired at the end of the day or ache or say they cramp at night, most primary care physicians know these days that evaluation by a vein doctor is probably the best thing to do, and they will refer for evaluation, and usually an ultrasound is done to see what's going on.
I'm curious, say someone's watching at home right now and they're like, you know, sometimes my legs kind of ache at night, or what are some of the things that people at home maybe need to think about and think that they need to give you a call because you can help?
If you're experiencing any pain in your legs, especially after standing for a long time, swelling in your legs, especially near the ankles, cramping at night when you're sleeping, or restless leg, then see your primary care physician, and they'll refer you to a vein doctor, or if you know of one, definitely visit them. It is covered by insurance, so that's the good news. It's not a cosmetic issue, it's a true medical problem, so I would advise that they definitely can improve their quality of life if they seek out the right doctor.
And I know we've been able to hear from several of your patients and testimonials. I know you like to share a lot of your testimonials as well to get the word out there, and especially talking about the technology, how easy of a procedure it is. What do you hear? What feedback do you receive after from your patients?
Patients are grateful. They're grateful that their legs feel better. Many of my patients that are in their 60s say, wow, I should have never retired, or now I'm not going to retire. So when they're happy, it really reflects back on you as a physician, and it makes you happy. So in turn, I'm very proud to show these patients.
And I know I can just tell the way you're smiling and how you like helping others. What would you like people out there to know about what you do and why they don't need to wait? They don't need to live with this discomfort if they fall into that category?
Many patients that have any of the symptoms we mentioned, the pain, aching, swelling, cramping in their legs, they do not have to live that way. It is not a complicated procedure. It's a simple in-office procedure. See a vein doctor and live a better life.